Hello everyone. I hope you can hear me. We will get started on the webinar now. So good morning, good afternoon, and good evening to everyone, wherever you are in the world. We're so happy that you're here today with us for the webinar that is officially launching the Adolescent Kit for Expression and Innovation, Adapted Resource Package for COVID-19. This is a very exciting opportunity for us to introduce the package to you today, and we have lined up many great speakers for you. We will hear from my colleagues in ADAP HQ, Education, and I will present on behalf of Child Protection and Office of Innovation. And we have with us today our two colleagues from Indonesia and Tajikistan country office, who will present to you how they are going about putting the adapted kit resource package into practice. They're part of 2 out of 5 country officers who have helped us pilot test it. And we're very excited to hear their presentations on their progress, plans for implementation, the challenges and solutions they've experienced so far in this process, and any key lessons learned and advice they have for us already. So all of these presentations will be followed by a Q&A session where we hope that you will engage with us by posting your questions, comments, anything you wish to share in the box that's called Q&A. So since this is a Zoom webinar, you both have a Q&A box and a chat box. And we encourage you to use the Q&A box as it is a little easier for us to control the information that goes in there and not in the chat box. So during the Q&A, we will address the questions to the speakers, and it will be a great help if you tell us who your question is for by indicating the first name or the country or the section of that person. If the question is addressed to everybody, feel free to just write for everyone, and then we will easily be able to identify who should reply to it. All of the questions will be also provided to you in written answers. We hope to send to you on Monday the 2 recordings, because we had a webinar this morning as well, along with the PowerPoint presentation and the full Q&A document from both webinars. So that should be in your emails on Monday midday, New York time. If you have any audio or visual issues, please let us know in the chat box, and we will try to help you sort them out. My colleague Erica will now post the link to this PowerPoint presentation, so you're welcome to download that and follow along as we progress through the webinar if you're having any issues. Erica will also post all of the links, relevant links to the adapted kit and the original kit. But without further ado, I want to pass over the floor to my colleague and chief, Jumana.
Thank you, Christine. Colleagues, good morning, and hope you and your families are keeping safe and healthy. Let me start by welcoming you to this webinar and expressing our excitement to share with you today some of the global products that UNICEF has developed to respond to adolescents' priorities and needs in the COVID-19 crisis. We're very happy to have both UNICEF country offices and partners connecting with us today. We see this webinar as an opportunity for learning, motivation, and connectedness across regions and countries. So thanks for connecting. As all of us noted, COVID-19 is a universal crisis, affecting all countries of all income levels and all adolescents and young people in 3 distinct ways. The first one is that young people are affected by the virus itself, although the number is small. The second is they are being affected by the immediate socioeconomic impacts of the measures that are being designed to stop the transmission. And the third one is by the disruption in services, which will result in delays in achieving the SDGs. Now, as we all noted, COVID-19 is really affecting the adolescents in terms of interruption of their learning through formal and non-formal education. Even though distance learning is being provided, some of the most disadvantaged adolescents are not getting this opportunity. We also also know that the health services have been interrupted.
Jumana, sorry, your microphone sounds a little far away.
Can you hear me now?
Yeah, that's better.
Okay, sorry about that. We also know that health services have been interrupted. Also, domestic violence have gone up, and usually girls are at a higher risk for GBV in these circumstances. We also know from previous experiences and shutdowns that young people, and especially girls who are out of school for an extended period of time, are much less likely to return when classrooms reopen. As a result, disrupted education may lead to a rise in child labor or child marriage. Now, how UNICEF has been responding to the COVID-19? It has been two areas that we have been focusing on. The first one is about controlling the spread and mortality by educating and informing the community and adolescents about the essential information to prevent and respond to COVID-19, as well as partnering with them as change agents to take action, prevent xenophobia, and provide support. The second area of intervention is responding to the socioeconomic impacts on adolescents and young people, and ensuring that adolescents continue to access learning, especially the most disadvantaged, as we mentioned earlier, health, nutrition, and wash services, protection, safety, and care, and social protection and safety nets. In a summary, some of the key principles, next slide please, Christine. Some of the key principles that have been guiding our work are applying a positive development approach, where we acknowledge young people as assets, as right holders, and not problems or threats. A second principle is applying a rights-based approach. Adolescents are not a homogeneous group, and applying an equity lens is instrumental to effective programming, where barriers are broken to allow all groups of adolescents to enjoy the same rights, resources, opportunities, and protections. Christine, next slide, please. And a third principle is meaningful participation, which is a key one, and an approach that we have been applying where adolescents' voices are heard and taken into consideration, and where adolescents are provided with the opportunities to lead and influence within their societies with ethical and safety standards. Obviously, the do no harm remains to be a key guiding principle in our work as we provide increased opportunities for adolescents to participate. Finally, by working across the first decade and the second decade of a child's life, we're applying a life course approach and ensuring that investments across both decades are key and will contribute to break cycles of poverty. Next slide, please, Christine. This is a slide that shares with you some of the products that we have been working on in response to the COVID-19. They do include one particular resource that was developed in collaboration with the Compact for Working with and for Young People in Humanitarian Settings. So it is an interagency guidance, which is the third one from the left. Also, there is a tip sheet on how to engage young people in responding to the COVID-19. Another one is about online safety. And the fourth one is about the Adolescent Kit, which we are meeting about today. And now I would like to pass the mic to Priya to tell you more about this Adolescent Kit and the adapted resource package, which we are very excited to share with you today. So we do hope that you find this webinar useful, and we look forward to staying connected with you and to learn more about your work as you use this kit. Over to you, Priya. Thank you.
Thanks, Jumana. And hello and good afternoon, good evening, good morning, colleagues, wherever you are. And thanks, Christine and Jumana, for starting us off. Hello, everyone. My name is Priya Marwa, and I'm based in UNICEF in New York. I focus on adolescents in humanitarian and peace-building situations. And I also oversee the Adolescent Kit initiative in our team that I will be speaking about today. So we're really pleased to discuss with all of you some opportunities for learning and expression for adolescents and coping with stress during these uncertain times. To give you background, UNICEF has developed the Adolescent Kit for Expression and Innovation. And in the next slides, we'll also be discussing with you how we have adapted this particular Adolescent Kit for COVID-19, which is the adapted resource package that we are so happy to launch today with all of you. First, let's briefly look at what the Adolescent Kit is in its original form, and then I'll take you through the Adolescent Resource Package, adapted resource package that we've developed for COVID-19. So a bit of background on this slide. The Adolescent Kit was developed to support learning and psychosocial well-being of adolescents, especially girls and boys who are displaced and affected by conflicts and disasters. It applies a human-centered design approach and has been tested with adolescents in humanitarian situations, and very relevant to our discussion today, of course, especially as we discuss exploring learning opportunities for adolescents during COVID-19, be it in refugee camps or very remote areas or lockdown or quarantine situations. As mentioned in this slide, close to 16 country offices in UNICEF are actively utilizing the kit today, with many more interested, especially now. And we've proudly reached over 160,000 adolescent boys and girls with the kit. We hope to reach many more, of course. For most importantly, as mentioned in its name, this kit is about engaging adolescents through forms of art and expression so that they can find creative ways to express themselves, develop skills, and also just learn how to cope in such difficult time. Next slide, please. Through activities conducted in 4 phases, where phase 1 is to set up an adolescent circle. Phase 2 is about adolescents learning about themselves. Phase 3 is about adolescents conducting community interviews and starting to identify issues in their communities. And phase 4 is about adolescents developing a solution to solve the issues they have identified. Adolescents really try to build competencies that are key for their well-being and their overall social development. And we learn about these key competencies in the next slide. The activities through these different phases offer adolescents the chance to express themselves, solve problems that affect their communities, explore new ideas, and in the process, they also try to engage in positive, healthy dynamics and relationships and activities with their communities. The Adolescent Kit can be used by anyone involved in managing programs or working directly with adolescents in humanitarian and vulnerable development contexts, including staff who work across different sectors, teachers in child protection or adolescent-friendly space facilitators or youth facilitators. And also all or part of the kit can be integrated into already ongoing programs we have for adolescents in areas such as child protection or education, mental health, skills building, etc. Next slide, please. So the Adolescent Kit comes equipped with a comprehensive set of guidance tools and supplies. You'll see this on the slide. As displayed here, the quick guide is a good summary guide for everything that is in the kit when the kit arrives in country in a box. The foundational guide and program coordinator guides are really important guidances for our country office staff and their partners when we try to train them on designing and implementing programs with adolescents. And again, when training our staff and partners, we usually take them through the 10 key approaches that they should follow when working with adolescents, which are again very simple and action-oriented approaches. And lastly, the 10 key competencies, which I had spoken about earlier, which are communication, leadership, conflict management, self-esteem, stress management, teamwork, tolerance, hope for future, critical thinking, and creativity. So these are broad categories of sets of skills and attitudes that adolescents need to develop and use to be emotionally and socially healthy, learn and grow, and engage positively with their peers and communities around them. In addition, there are 3 types of guides in the activity box that arrive. And these are namely the activity guides, which are detailed activities for adolescents progressing from short to complex ones. Sometimes the long and more complex activities end up becoming community-based projects, as we'll see in some of the country examples from Tajikistan and Indonesia later. And then we have energizers, which are what they sound like: short, easy activities to help adolescents get active or to feel more calm. And then, of course, we have inspiration cards, which again, as the word says it, they are for inspiration and creativity. Next slide, please. So here's a snapshot of the supplies and stationery that are included in the kit. These supplies by design are not expensive or fancy and are reusable, replaceable, and they are easy to assemble. And this is what arrives in countries when the kit arrives in a box, along with all the other materials. Next slide, please. So the website for the Adolescent Kit for Expression and Innovation is right here in front of you. Please do explore it after the webinar or later when you have time. It's an excellent resource where you'll find a lot of the guidances, translations, and also videos and how each of our country offices is implementing the kit or integrating it as part of their overall programs. Next slide, please. So let's learn what is in the adapted resource package for COVID-19. As explained in the slide, it's a resource package of adapted activities from the Adolescent Kit that adolescents can self-administer now to promote their psychosocial well-being and learn new skills in times of stress and while staying at home. The main target of the resource package is adolescents aged 10 to 19 years, and our Adolescent Development and Participation section in UNICEF has worked closely with several colleagues. We'll hear from some of them today in the webinar as well, from education, from the mental health, child protection teams, innovation teams, and some of our great regional and country offices, and especially some of the country offices who are also piloting and adapting and contextualizing this package in country. So it's really, really been a collaborative effort to get to this stage and to get this adapted package to you all. Next slide, please. So let's explore what's inside this great resource. Well, we'd like to say that there's a little bit for all of us to use, including many of us who are parents and have children in their teens and want them to do some of these activities or want to try it out with them. So I definitely hope some of us will give this a trial as well. And here you will find in the adapted package, you will find the introductory package, which has quick guides for facilitators and quick guides for parents and caregivers. You'll find 12 adapted activity guides, 10 adapted energizers, and 24 adapted inspiration cards. Next slide, please. So let's go through these. First, what's in the introduction package? It's really your 101 to knowing what's in this entire package and how to use it. So you must give this a read. You'll be able to get some background on this, on the entire Adolescent Kit, how it's been adapted from its original form, as well as a list of the various activities that you see in the slide there that we have adapted. So you'll see a list of the 12 activities, and you can also see how one activity then aligns with the competency and the phase. So for instance, the activity Silence and Sounds aligns with the competency of communication and expression, coping with stress. So that's what this activity helps in terms of aligning with the competency, and the phase of the Adolescent Kit program it fits under, which is knowing ourselves. The introductory pack also has instructions for program coordinators in our country offices, and also quick guides for facilitators. Many of our facilitators are young people themselves, and also for parents and caregivers. For parents and caregivers, you'll find a set of instructions that will help you support your adolescents in the home. It'll give you a set of instructions, list of prompts to help adolescents get through activities, maybe provide them some additional ideas, maybe try to do some of the activities with them together. And similarly, for facilitators, you will find information for planning and facilitating activity sessions, how to conduct them remotely, a list of prompts and tips to encourage and get adolescents through the different activities together. So if you're a program coordinator or a facilitator who works with adolescents, who wants to use these materials, or if you're a parent or caregiver and want to try these out at home with your kids, please read the quick guides and instructions. We've really tried to make them simple and easy for you to navigate through. Next slide, please. Next, let's look at these colorful activity guides. So we have 12 activity guides, as I mentioned, for adolescents. We've color-coded these where each phase, like knowing ourselves, connecting with others, taking action, they have their own color-coded activities, so it's easily identified. The cards on the left side are step-by-step instructions for adolescents themselves on how to do the activity, how to keep creating and learning from them, and how to share them with others through online or offline channels. And at the back of the card, what you see on the right side, there are instructions for facilitators and instructions for parents and caregivers. So they come as activity cards, and you can choose or do some or all of them. And in the presentations from Tajikistan and Indonesia today, we'll also see how these countries are translating them in the relevant languages, contextualizing them to suit the local context. And these are also designed in such a way that country offices can get these out to adolescents via various channels like WhatsApp or email or TV, radio, or even print these out and have these handed out to during distributions of food and other supplies, especially for remote populations or adolescents who don't have access to devices and technology. Next slide, please. Next, we see the orange color cards that are the 10 energizer cards on the left. These are fun and energizing activities, building adolescents' abilities to complete the activity guides and encourage them to just relax, enjoy, have some creative and constructive entertainment with family members or even by themselves. Similarly, on the right, the purple and the blue cards, they are the 24 inspiration cards, which are fun and engaging and very practical activities to keep adolescents inspired and motivated. And again, they can be done by adolescents themselves or with family members. Next slide, please. So this is where you will find the Adolescent Kit Adapted Resource Package. This is the site to go to, and this is available for all of our UNICEF and external partners. And this is what the page looks like right now when you get there. So you'll be able to access and download all of these materials. Next slide, please. So this is my last slide before I pass on to my colleague Bassem. We wanted to underscore that the two resources I have spoken about just now are complementary. In its original form, the Adolescent Kit activities are meant to be carried out through in-person interactions between adolescents in facilitated group sessions. That's how the kit was originally designed. In contrast, the Adapted Resource Package activities are offered for adolescents that can be self-administered by them at home or in their local setting, and also through traditional and digital platforms such as radio, WhatsApp, etc., as I had explained. Similarly, the Adolescent Kit in its original form is mainly for facilitators in our country offices who we usually train. We take them through all of our different guidances, especially because they are working with adolescents who are deeply affected by displacement or trauma or other situations. And this is done through in-person interactions. It's really seen as a program. Whereas again, for the adapted resource package, we have instructions that are even there for parents and caregivers to implement the activities with the adolescents at home. Then we have the Adolescent Kit in its original form, which is a rich resource that contributes to building a set of comprehensive skills over a period of time. And sometimes these activities can also turn into, like I explained, community-based projects, depending on how complex things get and how big your program becomes. Whereas for the adapted resource package, it focuses on a fewer set of skills that we find most useful for adolescents right now during isolation, and also during times when they want to try and learn and have some creativity and problem solving. These activities are also relevant to be carried out in the recovery phase of COVID and in situations where adolescents are unable to gather due to safety concerns, social norms, or for disease outbreaks like we're seeing right now. Finally, some country offices and partners may opt to implement the adapted resource package right away, which we encourage you to do so. But we also encourage you to transition back into having the in-person sessions with adolescents in group facilitation with the facilitators when and if the situation permits. And sometimes our country offices will probably juggle and go back and forth depending on what the situation looks like in their country. They may try to say, we'll have some in-person sessions, and when the situation demands, we will move to remote, or we will move to doing things in a different manner and use the adapted package then. So we really see these two resources we're presenting to you as complementary here. And now I'll turn over to my colleague Basim from UNICEF Education. Thanks.
Thank you, Priya. Good morning, everyone. I just want to make sure that my face is visible on the camera. Great.
Yes, it is.
Thank you. So hi, everyone. It's nice to connect with all of you. My name is Basim Nasser. Because of the timing difference, many times we haven't spoken to each other. I am at HQ at the education team, leading the work on skills. And it's been a real pleasure working with Priya and the ADAP team on this very important knowledge and training product in terms of the original kit, but now also the adaptive resource kit that supports adolescents learning and skills building. So building adolescent skill is really an integral part of UNICEF's education strategy in terms of making sure that every child learns. Transferable or life skills or 21st century skills are key skills in this regard and are very much related to serving the mental health and psychosocial needs for children and adolescents. By fostering transferable skills necessary for managing emotions and building healthy relationships, and by socially and emotionally engaging with others in a healthy way, these skills play a crucial role in supporting adolescents to cope with trauma and build resilience, which supports them to heal and be ready to learn, and eventually for the other outcomes, such as supporting them to find work and engage and participate within their communities. What we have noticed within the education response that in light of COVID-19, most countries have turned to distance learning as a means of mitigating for lost time in school. So different modalities are being implemented, ranging from online learning, the use of mobile, radio, TV, or printed materials. However, in many countries, we have noticed that official distant learning modalities have largely ignored the purposeful integration of skills development and have focused mostly on foundational academic skills and such as languages, mathematics, science. So we found that to be a big time lost opportunity in terms of developing those skills that are going to be really needed by the adolescents. Furthermore, there were huge inequity issues within those modalities that especially with regards to the poor, young girls, and the disabled. So this is why we're so happy in working with the ADAP team and working with all the country teams, both the ADAP and the education section, but all the other partners in promoting this kit, because it will allow both governments and implementing organizations to ensure that skills development is integrated in their remote learning responses, whether it's radio, TV, online, or paper-based. And eventually, in the opening, going back to this adapted kit or the original kit. So from this forum and this webinar, I really encourage all the countries who have not been engaged in this resource kit to utilize it, take parts of it, adapt it within their response within a continuity of learning context, but also within the opening up and as going back to the normal, to ensure that all the adolescents that in your country are developing the skills that they need to learn, eventually find work and engage with their communities. Looking forward to engaging further with the colleagues. And I'm going to pass over right now to Christine, who is going to be talking about the child protection angle within the adolescent kit. Christine, over to you.
Thank you so much, Basim. Today, I'm presenting on behalf of our colleagues in child protection in the mental health and psychosocial support unit, as they are now in a time zone where they're asleep. So I will take this that they presented in the morning webinar and see if I can do them justice. So for Those who are not too familiar with the term mental health and psychosocial support, or MHPSS for short, it implies that there needs to be a close relationship between the psychological and social aspects of a child's development and well-being. So this means personal, social, and environmental factors all influence the well-being of children, adolescents, and their families, and the adolescent's ability to recover from adversity. So MHPSS approaches therefore cover both social and psychological interventions, and support can be provided by both professional and layman staff. UNICEF's approach prioritizes mental health and psychosocial support at all stages of a child's life, especially for children and adolescents, particularly girls, and those who live in low-resource settings. As part of a comprehensive approach to MHPSS, it's really important to establish adolescent-specific activities that promote their mental health and their psychosocial well-being. Adolescent-focused interventions need to be age and gender appropriate, and they need to include expressive mental health and psychosocial interventions. This includes, for example, peer-to-peer support activities, selective life skill learning and competency learning, aimed at enhancing their resilience and their coping skills using discussions, creativity activities, innovative activities, etc. So the Adolescent Kit for Expression and Innovation, and especially this adapted resource package, is a key resource within UNICEF's community-based MHPSS operational guidelines. These guidelines have been rolled out in more than 30 countries so far, and they recently also informed the COVID-19 operational guidance for implementation and adaptation of MHPSS activities. The guidance outlines approaches and resources for adapting adolescent-specific MHPSS activities, and the kit is featured as a core resource for this specific age group, the 10 to 19. The adapted version of the Adolescent Kit is a really rich tool that has many activities that aim to enhance resilience, teach coping skills, and promote the mental health and psychosocial well-being of the adolescents who engage in the activities. And this is something that we really, really need to promote during these times of COVID-19. So Child Protection, they consider this tool to be an excellent resource for the child protection and MHPSS actors and colleagues to help establish adolescent-specific and appropriate activities. And if you have any questions about this, child protection, MHPSS, please address them in the Q&A, and I will make sure that it goes to our colleagues in the section, and they will provide the answer in writing. I will also be sharing some insight from our Office of Innovation on behalf of our colleagues from there. And as an organization, one of our priorities is to ensure that adolescents are ready for the future. And as such, we need to understand how important it is to respond to the rapidly evolving skills requirement for example, employability in the future. The future is going to require much more specific skill sets and more sophisticated cognitive abilities of the future workforce, which is the current adolescents. And we see that this has been happening over decades in the history of our world, where we go through automation processes and industrial evolution, and we're currently experiencing that with robotics and artificial intelligence. And this is why we're looking to the future and to see what the skills are that the adolescents need to develop to be able to gain employment within this evolution. And the future is telling us that the soft skills are really going to be in high demand. It's something that they call the imagination economy. And in this imagination economy, you need skills to be creative, imaginative, have critical thinking skills, and a strong ability to collaborate. These will be the most in-demand skills because they're the most difficult for machines to learn how to master. So to address this, the UNICEF's Office of Innovation, they have created various programs to help address this need. For example, the Upshift program that you can see mentioned here on the slides, and the 2 links at the bottom go to pages describing it in more detail. Upshift aims to develop adolescent skills to be able to meet the future workforce needs through boot camps, workshops using human-centered design processes. But many times, adolescents need to develop the softer underlying skills for them to be able to successfully complete the Upshift programs, as they are more complex and advanced in terms of high level of thinking and innovative thinking skills. So the Office of Innovation sees the Adolescent Kit as a tool that allows for that continuity and extension of the innovation skills learning pathway by ensuring that adolescents and young people are familiar with and are exposed to concepts such as research, being empathetic towards other humans, ideation, prototyping. They get to know themselves at a deeper level. They get to connect with others. They get to start taking action in their communities, which they can then use to transition into these higher level innovation programs. So the next steps for Office of Innovation and the ADAP section is that we're looking to strengthen the linkages and referral pathways between the Adolescent Kit and programs such as Upshift to create a better life cycle approach. Also, when UNICEF's mandate ends at 19, we want to still continue making sure that they can engage in these meaningful programs. So we will look into how the Adolescent Kit can complement Upshift and vice versa, especially for the younger age group. So with this, that concludes our presentations from HQ. And again, please feel free to post all of your questions also to the Innovation Office. I'll make sure that they get them and answer them. So thank you to everyone who presented. I will now turn over to our colleague from Tajikistan Country Office, Kruzbek. So Kruzbek, please introduce yourself, and we look forward to hearing how you've been using the original and adapted kit in your country program.
Thank you, Christine. Hi, colleagues. Again, good evening, good morning, good afternoon. My name is Khushbakht. I'm Adolescents Program Chief in Tajikistan Country Office. And in this brief presentation, I'll try to continue the thoughts and the presentation of my colleagues from HQ in terms of how this great resource was translated at the country office level and used and especially adapted now for COVID situation, both as a great resource in itself, but also in a way how it could help be from the angle of mutual complementarity with other resources and programs that we have. So if we can move to the next slide, please, Christine. Tajikistan, just to give few background and to set this stage on Tajikistan. Tajikistan, as you may well know, is a small landlocked country in Central Asian region with the 70% of population being under age of 30. So this means we're dealing with a huge adolescent and youth population. Out of this 70%, adolescents themselves, what we in UNICEF understand as 10 to 19 years old, are about 2 million out of the total population of 9 million. So this makes around 21 to 22%. The children in Tajikistan from 0 to 18 are 41%. So it's a huge youth population, adolescents that we think. And at the same time, faces a lot of challenges. Our national adolescents baseline study that was conducted in 2018 showed that every third adolescent in the country experienced depression. We are seeing the highest school dropout rates in Tajikistan, especially among girls, and the issue of transition from 9th to 11th grade, which is in our system is a very essential part of for school to work transition is an issue. And most importantly, around 30% of adolescents, this is around adolescents and youth in the age of 15 to 24, are not in employment, education, and training, which shows the lack of job opportunity and the whole issue of the school to work transition. And last but not least, for the demography of Tajikistan, the COVID situation has been quite impactful in our situation. And during last 4 weeks, we've been having a spike. We started a bit late than other countries, but again, given the youth demography, we still have a quite serious number of cases now, although we're not in full lockdown, official lockdown, but we are seeing a huge impact, and the schools have been closed in May, late May, but still we're seeing a huge impact. So this is just to set the scene, so you see how we're coming into the program. If you can move to the next slide, please, Christine. And in Tajikistan, so given all this situation, UNICEF, we have a specific standalone program on adolescence development, which deals across the number of issues. And there are three main areas that we work. It's adolescent health, adolescent skills, and adolescent engagement, participation, and decision making. So how we started thinking about the kid, just to give you a small background of the journey that we had, we started thinking earlier than 2018, but we came to the phase of bringing the kid to Tajikistan in 2018. We started, first of all, as an office, as a broader office, thinking about the one big framework that's called Adolescence Competency Framework, to see what are exact competencies that adolescents need in Tajikistan. So specific content, context-specific, in a way, competencies. And this is, we take, of course, as we all know, this core life skills, transferable skills, now what we call 21st century skills, this 10 or 12 competencies that we have, and also in the UNICEF, global UNICEF skills framework that quite well shapes these competencies. But we also took them and tried to understand which one of them are specific to Tajikistan context. And after defining them, we started thinking about the mechanisms, how we bring them in Tajikistan, through what doors, through what in-system entries that we have in the country. And we did this with them as a joint, as an office with our education colleagues. And after seeing the competencies, we defined that we can go both through the formal education system, but most importantly through non-formal education system, which is in Tajikistan as quite an established system under the Ministry of Education, in so-called centers for additional education. There is an additional education system infrastructure in the country that has not been that well used. And that's specific, so these are after-school centers that provide skills building opportunities. And that entry we found very useful. And through that entry, we started defining the curriculum and content. And we naturally went back to the great resources that we have developed as UNICEF at HQ level and tried to contextualize them. First, we started with the more social entrepreneurship related ones with Upshift, but soon we realized that adolescents in Tajikistan need kind of a broader foundational curriculum that allows us to reach much more people and be complementary to Upshift. And also something that we looked earlier is a peace building competency. So we have a peace building angle of the programming as well. And with that, we looked at the adolescent kid. We found it very useful, and we started adapting adolescent kids. So the first contextualization was conducted. We adapted them to the Tajikistan context. We also back then developed 12 sessions that are most useful in a modular way. They are delivered. And we started delivering them in something called Adolescence Innovation Labs that are established in these centers for additional education. So this infrastructure of non-formal education that exists. We then even expanded this infrastructure to youth centers. We have youth centers under the State Committee on Youth Affairs, again, government-led infrastructure. And we even tried opening Innovation Lab, which is quite well working now in one of the universities of the country. University of Business, Law and Politics, and in this innovation labs, Adolescent Kid came as a second but really important curriculum, the really important content, and now it's being delivered. And in a year, it's covering 300 people in a normal situation. With COVID, of course, we have a standby on some of the activities, and we're going more distance learning. But it became a very important tool that builds 21st century skills of adolescents and even youth. So it's going this age range quite big. In total, we have now in the country 15 adolescent innovation labs established in 12 towns and districts of the country, out of total 68 districts and towns of the country. And in all of them, Adolescent Kid Contextualized is being delivered by mentors and including teachers of these centers for additional education, the one under the Ministry of Education. So in this way, we brought it into non-formal education system as a very interactive curriculum. that is reaching quite a big number of adolescents. Here you will see one quote from one of the participants, one of the adolescents, in a way that how it's being perceived by adolescents themselves. And I believe this adolescent is a 14 years old young girl who mentioned that uh, it's not just drawing that they have done in one of the exercises, in one of the sessions, but it's the most important part is thinking and realizing the peers around them. And this is very essential that we bring it that way, from this bigger perspective. We did also documentation of our experience, the first documentation to see for the scale up. Now we're looking at the scale up. Now we are planning to establish adolescent innovation labs in all 68 districts of the country by 2024, another 50 coming in coming 3 years. And adolescent kid will go without it. An adolescent kid will be part of the system that will cover at least 30,000 adolescents every year in the country, starting from 2024. But until then, it will be much more numbers that will cover. If we can move to the next slide, please. Here you will see how the documents, how the kit has been turned into translated and contextualized in Tajik language. And you will see some of them, for example, some of this look like a booklet. And this specific one, for example, was used by teachers in summer schools that are led by the Ministry of Education. So we try to find many other avenues as well, in addition to Adolescent Innovation Labs. And in our country, Ministry of Education conducts sponsors summer schools during summer every year that cover around 5 to 10,000 children, and out of them there is a huge portion of adolescents. We went even to that system of these government-led summer schools that will happen every year, and we contextualized the adolescent kid in a form of the summer school curriculum. And in that way, it was also delivered and reached quite a number of young people. In terms of the results of this one, just to wrap up on this broad adolescent kids contextualization in Tajikistan, and we can go also to the next slide, Christine. What we have seen that adolescent kids became a content, a very good tool that helped us also to link in terms of the results of the programming with our mental health program, adolescent mental health program that we started for establishing the service, but from the peer-to-peer angle. So the whole mental health of adolescents and depression issue has been indirectly also in the center. Issue of peace building. So across the border, we have the situation of low intensity conflict in our country. And there we look at the peace building competencies. And our, again, one of the great tools that we have we produced at the HQ level was adolescent toolkit adolescent as peace builders that was produced much earlier than the kids, I believe. And although we use that, that framework, excuse me, adolescent kit became also a very good complementary part to the peace building program that we have. Excuse me. And third, we have also used adolescent kits specifically to reach most marginalized children. And this tool allowed us to do so, especially children with disabilities, children in conflict with the law that we have access to and is a focus of our program, have been reached with Adolescent Kit. And we collaborated also with some of our local partners, Caritas Germany, for example, that works increasingly with children with disability, has been adapting the kit and using in their own programming as well to reach children with disability. So if we go to the next slides, now to the core part of this presentation of this webinar that we have. Now the main question is how we try to use the kit during the COVID situation. And here I have to say that we are still at the beginning part. So we reached the first milestone, but now we are at the milestone of developing and preparing for the delivery and reaching adolescents themselves. And here what we did, we used the adapted kit of 12 sessions that was just presented by my colleagues, and looked at it as a resource that we can use for distance and online learning. And as a country office, we're supporting the government in the response plan, and there's a response plan developed jointly with the Ministry of Education, broader one. And in that one, we have, in that response plan, we have an aspect on distance learning, so supporting the government with distance learning. The first part of that concept is developing TV lessons, and we have this good experience in some of our neighboring countries as well. But the second part is also developing non-education content and additional education skills content. So bringing adolescent kids as part of that bigger plan, we are now developing adolescent kids in a form of a video lessons or video sessions to be delivered through hopefully through national TV. That's the plan that we have with the government, but as well as through different platforms. Until now, we established these partnerships, and we're seeing a lot of anxiety, a lot of excitement, sorry, from the Ministry of Education, from the Youth Committee with whom we're working also for online volunteering, and they are also very interested to use this resource in the scope of webinars. We defined local platforms and digital spaces that can be delivered, and in just so you know, in Tajikistan context, one specific element is that we have 75% of the country being rural areas, and internet connectivity is an issue in some of the rural areas. So we're trying to both go digital, but also pay attention how we reach the most marginalized groups through other means of distance learning. And here TV comes as a very good channel. And we also, as I said, defined webinars as one of the possibility in our plan that is composed and we're working on with the State Youth Committee, which is also leading risk communication during the COVID situation. And in the next slide, please, we can see contextualized and translated resource package in Tajikistan. So this is how it looks now. All these 12 sessions that was mentioned by my colleagues are translated and designed accordingly as well, based on the original design. We have also inspiration cards and energizers. Energizers are also done, and we are now ready to start shooting the video sessions, but also having these materials as something that will be still delivered through different means, while managing having it as a main video sessions, but having handouts, especially also the guides for parents, how we involve parents is being considered as an essential part of it. Next slide, please. So as I said, there are three modes of delivery that we have identified up to date. Is a facilitator-led video sessions for national TV targeted to adolescents and parents. So in this one, we aim bringing this also parental element as well, and giving hints to parents how they can use the kid resources while at home. The second mode is adolescent lead video sessions. So this one we found very, very useful from our past experience, that sometimes adolescents led and peer led sessions, when it comes learning sessions, are much better perceived by the audience, by the special adolescent audience. And what we're looking at also developing adolescent led video sessions, and in a way this content will be used in a flexible mode, let's say, those sessions that we have. And last but not least, facilitator-led webinars for adolescents and youth. This one is specifically online, as I mentioned, within our bigger plan with the Youth Committee and risk communication that we want to deliver. Next slide. And in terms of the future plans, as Bassem said, it's essential that we look at this kit as a resource for current COVID situation, but also think about when we come to normal, how it will go. And especially given the experience in the past and realizing how the post-COVID-19 world will have its own rules of the game, its own maybe nuances, and many new things that will come. What we're looking at now, and this is the map of Tajikistan. This is roughly what you say, some here and there, the numbers and signs. These are the places, for example, where we have adolescent innovation labs established. So this is the infrastructure that we have in different parts of the country. Something interesting you will see on this map, on the right top side and inside the map as well, you will see the percentage of the NEET population across the country, in which region we have a higher number of NEET. And in some of these regions with higher number of needs, and especially also regions, cross-border regions, you will see more number of innovation labs established and concentrated. What we plan to do, we'll plan to continue the work of innovation labs because they are permanently working, let's say, centers for skills building within the non-formal education, supported by the government. Adolescent Kit is delivered there along with Upshift, and peace building curriculum in some of the cross-border regions. We're bringing also digital skills component there. So Adolescent Kit will remain one of the core parts of our skills building work in these labs. And as the labs continue, so the coverage by the Adolescent Kit will continue. But also, secondly, I think we're looking now, seeing the COVID situation and importance of the distance and online learning that we'll have after COVID. An opportunity, and depending, of course, on the results we will have soon, but after we start delivering the video sessions, also adding the element of complementary distance and online delivery and use of the original and adapted kit. So this delivery of distance will still continue. I think we'll try to find other venues and opportunities to have it as a complementary element of the work that we do within the innovation labs. Two other doors that we see that will definitely continue working. First is bringing this parenting aspect quite strongly, as we have now adapted kit also with guidance to parents. We have a bigger parenting program within the country office with our child protection colleagues leading on it for prevention of VAC. We will bring this parenting element also of the kit, and we'll try to see how we can use it further. And the second and last, let's say, new element that we're looking at, so using the kit with its original purpose. So with using the kit with emergency and including it as a standard package response for Tajikistan as well, because Tajikistan is, as you may know, is a country of high seismic region, and we have usually a lot of earthquakes and other man-made disasters during the years. So we have a quite strong work with the Committee on Emergency Situations of the country, and we have a package of response. But until now, that package of response did not include physical supply kit and with such a content as adolescent kit. So this was the original purpose of the kit when it was designed in 2017. And I think that seeing the COVID, we'll try also to include it within the standard package of UNICEF, which has also some supply part, but also bringing in and the package and keeping it with the Committee on Emergency Situations to be used in cases of earthquakes and other disasters across the country. I'll stop here and we'll be happy to respond to any questions. Thank you.
Thank you so much, Krushbak. That was a wealth of knowledge and amazing lessons learned and plans for the future, especially how you're planning to use both the original and the adapted kit complementarily. And that's very great to see for us. It's also, we're learning a lot today from all of you. So I want to pass over the word to Tiziana from the Indonesia office. Please feel free to post questions to Krushbak during the presentation as well. Tiziana, over to you.
Thank you very much, Christine. Hi to everyone. Good morning, good afternoon, and good evening to all the colleagues who've joined. It's really great to be part of this webinar today. Christine, if we could go to the next slide. So I'm here representing Indonesia Country Office. And Indonesia, for those of you who don't know it well, is an amazing country. More than 17,000 islands. The distance from east to west, I believe, is the same as from London to Tehran. Just to give you an idea, there's 3 time zones. One of the most populated countries in the world, of which 46 million or 18% of the population are adolescents. Many of my Indonesian colleagues refer to the country as a supermarket of disasters. It sits on the ring of fire. Some of the most fatal disasters we have here are floods, earthquakes, and droughts, but there's also a great deal of volcanoes to deal with. 2 years ago, there was not just an earthquake, but a tsunami as well, and we faced a big challenge with over 200,000 IDPs. Currently, 30 million young people live in high hazard risk areas in the country. We can go to the next slide. So as I said, just to give you a bit of context, 46 million adolescents, about 80 million children in total. Of these adolescents, 12% are already living below the poverty line. Recent data from the government shows that 60% of adolescent girls and boys aged 13 to 17 reported having experienced one form of physical, psychological, emotional, or sexual violence in their lifetime. And currently with the pandemic, over 60 million children and adolescents are learning from home with many difficulties due to the limited amount of offline learning opportunities. But already before this pandemic hit, over 4 million were out of school, and 96% of these 4 million are older adolescents, 16 to 18. The fear is that this number would increase due to the pandemic. This puts girls, especially at increased risk of harmful practices. Already before the pandemic, 1 in 9 girls are married before the age of 18. Second highest youth employment in the region, 20% of our adolescents here are not in education, employment, and training. And in recent times, more than 10% of youth report experiencing mental health problems. We can go to the next slide. So UNICEF Indonesia has actually been engaged with the Adolescent Kit since 2013. It was one of the countries where the initial pilot was done. And we have been implementing the Adolescent Kit, the original kit, since 2015. In 2018, we did an assessment of the kit just to find out the impact and to find out how it was actually being rolled out in Indonesia and what kind of changes or adaptations needed to be done to roll it out more efficiently. So we found that positive adolescent development and participation cannot be realized without really contextualizing the materials that we use, understanding the nature and the impact of social, cultural, and political environment in the country, or in the case of Indonesia, really in the region that you work in, since it's such an incredibly diverse country. Local support to really create an enabling environment was really important, as sociocultural norms don't really support adolescents speaking up, especially in rural areas, but not limited. There are many, many platforms for adolescent participation, but what we found in this assessment is that meaningful participation opportunities were limited, and young people are really asking for them. We also found that the Adolescent Kit was really championed by adolescents, by youth facilitators, by their parents, even by government officials. They found it to be very participatory, they found it to be fun, active, and they really found it to be practical, to really give some practical results, especially for the communities. If we can go to the next slide. So some of the lessons that we learned, good practices we found: engaging government for mainstreaming and linking these methodologies into existing policies and programs from the beginning was vital. We linked up with the Safe School Secretariat, which is part of the Ministry of Education, and that proved to be very, very positive. We developed tailored modules that integrated different methodologies and specific thematic issues into the Adolescent Kit materials. So this included specific sessions or incorporating specific details on disaster risk reduction, on menstrual hygiene management, and on child marriage, and contextualizing to specific contexts. So the urban-rural context, the language, looking at how to simplify terminology and simplify the use of some tools. We provided partners with, sample plans of how to combine activities, how to combine energizers. We tailored capacity building modules for facilitators whose first language was not Bahasa Indonesia, for example, and we found that to be a very good practice. Among the challenges, capacity of youth facilitators, which in some cases affected the motivation of adolescents to attend, but also affected the quality of sessions. In some rural and remote areas, they found the content to be difficult. They'd never done activities that were so participatory, that were so interactive, and they found it difficult to follow. Obviously, this kind of methodology is already difficult to roll out within government systems. So even engaging the government from the very beginning, we still found it difficult to really mainstream it. And then one of our biggest challenges remains adapting the kit for adolescents with disabilities. It's something we're still working on, even as we prepare to roll out the new adapted kit. We can go to the next slide. So as with our colleagues in Tajikistan, we're also planning currently to roll out the adapted kit resource package. And in Indonesia, we already have some programs that use the adolescent kit, so we decided to work within our existing programs. So these include emergency response, or preparedness and recovery programs to do with tsunamis, earthquakes, and volcanoes. We have integrated the adolescent kit into one chapter of the life skills curriculum that we are currently implementing in 2 provinces in the country in junior secondary schools. In child protection programs in selected villages, we're using child forums, which are the official platforms for participation, to strengthen child marriage prevention activities. We're also working in programs that are aiming to engage young people in meaningful decision-making mechanisms at village and district levels. The original versus adapted kit, because I know there's always been some questions about how to implement. So the adapted package, we're using it as a complementary material during the pandemic, where schools and community-based learning centers are closed. In locations where the original kit was used as part of the curriculum, for example, as part of the life skills curriculum, the adapted kit will be used during the sessions and will be continued to be used once schools reopen as a way to prepare adolescents to come back to learning as a sort of psychosocial support toolkit. It's also going to be used to support alternative learning opportunities for out-of-school adolescents and complement the initial planned activities in back-to-school campaigns and in making sure that adolescents who want an opportunity to learn have it and are supported, especially after this pandemic. If we could go to the next slide. So we've done the first work around translating inspiration cards, energizers, and activity cards into Bahasa Indonesia, and now we're working with HQ colleagues designer, kindly helping us out to make sure that we have the material that's available in different forms so that they can be distributed via WhatsApp, social media, or in print as well. If we could go to the next slide. So these are just examples of how we've translated the different cards into Indonesian language. Go to the next slide. So just to go into a little bit the different approaches that we're taking in the country. We go to the next slide. So we have integrated key elements of the original adolescent kit into the life skills education curriculum, which is currently being implemented in 2 provinces in Indonesia in junior secondary schools. So what we did is that within the life skills curriculum, the last chapter, chapter 5, is called Taking Action, and it focuses on identifying issues, analyzing them, setting goals and objectives, and planning a project to address these issues. It is completely inspired by the original adolescent kit, and it's currently being rolled out within the life skills program with a target of over 4,000 adolescent girls and boys in 24 junior secondary schools. And this is with the full support of the local government in the form of what we call here circular letters or support letters, with teachers that have been trained and the support of school directors. We're currently working with local newspapers to see if it is possible for them to distribute materials for those adolescents who do not have access to the internet or do not have access to a family device they can use to look at the materials. Teachers will infuse activities and energizers as relevant, since this new adapted kit, there's very, very interesting activities that can be used to warm up the kids, to start off the lessons, to give us challenges after class, to motivate kids to continue learning during this pandemic. Go to the next slide. So we plan to use the adolescent kit in our work to address the issue of out-of-school adolescence, which is a very, very big issue here in Indonesia. So both the original and adapted kits will be part of the strategies to support universal education at village level. And this is part of the national strategy of out-of-school children that was adopted last year. looking at ways to reach adolescents, especially those who've been out of school for longer than 2 years, since we know that this is a critical time, making them less likely to come back to learning. This will have a focus on rural areas, and our main entry point are community-based learning centers that are managed by village authorities. Our target here is 300 adolescents and 20 village facilitators in 3 locations. If we can go to the next slide. So the original and adapted adolescent kit will also be used within our child protection program through child forums. As I mentioned before, this is the official platform where young people can participate in decision making, but can also learn new skills and engage with their peers. This will also be rolled out at the village level, working with youth facilitators in both rural and semi-urban locations. And this is part of Child Protection's Child Marriage Prevention Program. They will be focusing on sharing materials via WhatsApp and social media, providing online support to adolescents who want to conduct the activities, and working with YouReport as a way to report back on the activities and monitor. The target are 200 adolescents and 10 youth facilitators in various locations. Go to the next slide. We also have ongoing activities in post-emergency locations that were affected by both the earthquake and the tsunami. So we'll be working through established adolescent circles that were established during the emergency. We'll be sharing materials both through local newspapers and WhatsApp, and we'll be working with 200 adolescents and 10 youth facilitators as well. We can go to the next slide. One of the things that we started to do at the beginning of the pandemic is looking at the issue of mental health and how it's affecting adolescents in the country. So we're thinking of incorporating different elements, some of the most relevant activities, such as activities around meditation and stress management, energizers and inspiration cards from the adapted kit, into the online mental health sessions that we're running together with 2 youth-led organizations working on mental health, that focus on equipping adolescents with practical knowledge on mental health, meditation, where to seek support, self-care, etc. So what we're thinking is to encourage adolescents to do the activities and the energizers, and maybe do some of the inspiration card in the form of a challenge during and after the workshop, and then take the survey via YouReport to give feedback around how they feel after doing the activity, if they feel that they would change anything, if they want to share the activity with their peers. These are bi-weekly sessions, and we normally have 50 young people that are participants, and then hundreds that are so-called observers, YouReporters usually. And go to the next slide. So a recent YouReport of around 4,000 adolescents found that 52% of them felt either afraid or very afraid when they heard the term coronavirus. And this is something that has really pushed us to focus on these kind of initiatives and to see how else we can provide support to young people who are separated from their peers, who are at home, who aren't learning, and who are worried about their future. But on the plus side, what we found is that through these activities and through this, even if it's only bi-weekly engagement, when adolescent participants were asked to share how they felt after this session, you can see in the screen here, they shared their one word to describe how they felt. And overall, they said that they felt calmer, they were grateful, relaxed, blessed, and happy. So this is some of the motivation that we have going forward, knowing that these are materials that can help young people here in Indonesia, that there's a big need, and that we have to go beyond the digital divide, finding ways to reach the most vulnerable, to make sure that they have the support that they need and that they don't feel alone during these uncertain times. So thank you very much. That's it from me. I look forward to your questions and to engaging further. Thank you.
Thank you so much, Tiziana. This was really wonderful to hear. I think that one thing I want to stress before we move into the Q&A is that these kits and the activities, they need to be contextualized. As you've heard here, 2 very different examples of how that can be done. And it is something that does require some creativity on the part of us and our partners in coming up with kit fits, as the kit is not a standalone program. It needs to be integrated into, for example, an education program, a child protection program, where it will be complementary to the overall goals and outcomes for the adolescents within those programs. And that also relates to some of the questions we were getting about monitoring and evaluation. And Tiziana, I saw that you kindly offered to share what you have on that. And I think that this is one of the key aspects, is that we need to learn from each other, and our country officers who are implementing the original and the adapted kit are really the ones who have all the learning and the knowledge that we need to tap into. So we are definitely trying to promote some sort of a buddy system where country offices or at regional level connect with each other to learn from each other, not so formally through these types of webinars, but connecting more informally and hearing how it's done around the world. So this is a practice we would definitely like to encourage everyone to use. My colleague Erica, she has just posted the link to the global website for the kit. And on that website, you can see a list of the countries who are implementing the kit, and that will also help you in identifying who to reach out to. So next week on the 9th of June, we have a technical tutorial on the adapted kit. This will be a deep dive that's conducted and led by our kit expert, Juliet Young. And this will be a great webinar to attend for you and all of our partners, parents, adolescents themselves, anybody who's curious and want to learn more and ask more questions. Please join, and we will share the invitation immediately after this webinar. But moving into the Q&A, I want to kick us off with trying to answer a question from Laura on if the adapted resource includes activities using technology. Right now, adolescents are increasingly connecting to the outside world through screens. And definitely agree with that observation. That seems to be how we're connecting, like we are right now. Of course, adolescents are also doing that. And the fact is that the lesson kit can be as low tech or as high tech as you wish it to be. This morning, we heard from our Colombia country office colleague who explained to us that they have such a wide modality of delivering the adolescent activities that they start out with hard copies, printed versions that they leave in the food distribution centers for the parents to pick up and take home to the adolescents. And then we go from there to Krusbach's example of going in and making the videos. And we have from our Jordan country office, they explained to us that they're mainly funding it out through WhatsApp groups where they're gathering adolescents in a certain amount in each chat group. And then they sort of establish this peer connectivity through the WhatsApp groups. And they have a parallel system for the parents as well. So technology-wise, it's definitely up to the creativity and context and ability and capacity in the country offices to take that on. I want to say that at ADAP HQ and together with the Innovation Office, we are exploring how to digitize the entire adolescent kit. And this is something that if any of you have good ideas too, we really welcome them as well. I want to turn over the next question to Priya. Priya, we received a question from Annie on partners and how partners can engage, and I would like for you to address it. Thank you.
Yes, thanks. Thanks for that question, Annie. And we've been getting these questions from other partners as well. So one, it's not necessary always that we have to, of course, it would be great in any country for us to work with the UNICEF and whichever partner organizations that wants to utilize the kit. But there have been many countries where we've had partners just using some of the kit related activities as part of their programs. And in our website, when you'll go, you'll also see, we always say, if any partner organization is independently using the activities from the kit, please do fill this form out or inform us through sending us an email as to how you're doing it. We'd like to know how you're doing it. When UNICEF created this kit, it was done so that we could make it available to the world, to all of our partners extensively. And that's why we worked so hard to get the website in an external space. And even the adapted resource package is posted in an external space so that our partners can avail it and utilize it as they see best. But of course, if you're in a specific country office and you're new to this, or you want to understand how to go about it, please do check out the website. You'll find out the countries that are implementing the kit, and you have the generic email address which we check regularly, and you can email to us and we will try to connect you with the country office, or we will try to understand your context a bit to help you out and see how best you can use the kit. You don't necessarily need to procure adolescent kits to get started. You can actually get started right away by reading the materials. And as long as, again, as Christine said, your context permits, you have some partners, you have some ideas, you have some ongoing programs, I feel it's relatively flexible, adaptable to get you started. It does require some sort of a system for you to put in place and how you integrate it, etc. But once you've gotten to the rhythm of it, the activities itself are very easily integrated within the ongoing programs. Thanks.
Thank you, Priya. Kushbakt, I would like to turn the next question over to you. We received a question if you have been able to use the kit in programming specifically designed to reach adolescent girls, for example, Spotlight or Chloe, or in your innovation labs. And are there any special considerations for engaging girls, any results or promising practices?
Thank you, Christine, and thank you very much for this question, Maha. What we included, and we have indeed two, let's say, programmatic frameworks or scopes focused specifically on girl within the Chloe Partnership and Spotlight that we have in the country. We include in one of them, for example, within the one focus on girls empowerment within this Chloe Partnership that we have. We brought Innovation Lab as a spaces with increased focus to girls, where Adolescent Kit will be part of the combined package of provision of empowerment through both soft skills and digital skills. We have realized that our lessons learned was that we do often, in many countries as well, do Tech for Girls programs, but we see their missing line, that without the soft skills, those Tech for Girls skills cannot help them to be fully empowered. So we brought the kit as a combined package, give both soft skills and digital skills to girls, and only then they can be fully empowered within that partnership. And there are specific focus. Girls, when they graduate from Adolescent Kids, they come in the group of more with boys as well, but then they go to Tech for Girls specifically for girls in that. Within the Spotlight program, within the whole SGBV angle of the work and prevention of FAC, what we did, we proposed, based on the evidence that we have, that Adolescent Kids can be a program for both, as a part of empowerment for prevention of FAC. And these innovation labs in those targets districts that we have, and we deal with the issue SGBV, will be spaces where training will be provided, both as a prevention part, but also to those who are victims of violence, of course, wherever it's possible to refer them over.
Thank you so much, Kushbak. Tiziana, I was wondering if you would mind explaining a little bit more how you are using the monitoring tools in your programs with pre and post testing, and also if you have any reflections to share on how you do effectiveness assessment.
Thank you. So we haven't started using YouReport yet as a way to monitor, but this is one of the things that we'd like to do in this new phase. So we're still trying to think how to go about it. We had prepared a pre and post test that we use with the original kit. So one before the first ever session, and then the second, the post test would be conducted right after the different adolescent circles have presented their proposals and their solution ideas to the adults. It's not ideal, and we found that it was really, really difficult to measure skills and competencies. As you know, it's one of the hardest things to measure. So we really focused on sort of the feel indicators. We really focused on how adolescents felt, if they felt more confident, if they felt that they were able to speak up, if they felt safe. We rather focused on these kind of areas because we found that actually measuring the competencies was really difficult. So we focused on perceptions, which again is not ideal, but that's what we did. And then to complement that, we had an assessment study that I'm very happy to share with everyone that was done in 2 of our 5 pilot locations. And then there was the Deloitte study that I think some colleagues know, that where the adolescent kit work in Indonesia was used as a case study. And I think those 2 papers can provide a lot of background that focused around the enabling environment, capacities, bottlenecks, and other issues that we faced in rollout. And I'm happy to share all of those documents for anybody who's interested.
Thank you so much, Tiziana. Will, if you send them to me, I'll make sure they go out on Monday as well. So I want to explain a little bit about our projects for in the future for the kit. And as I mentioned in the Q&A, we are looking into adapting more activities, and it is also a goal of ours to look more into how to digitize the kit. In this process, we're really learning a lot from our innovation colleagues as they're going through the same digitization process with their Upshift program. So we hope to learn a lot from them and see how we can apply that to the adolescent kit, both the original and adapted versions as well. Besides that, and very, very relevant to what Tiziana was just speaking to, we are looking into how we can build the skills assessment suggestions into the module. It is, like Tiziana mentioned, extremely difficult, but our colleague Basim and our colleagues in child protection and innovation, they do have experiences with it and they have a lot of good ideas. So it's something that we will try to develop a global product around that will then, of course, needs to be taken by country offices, regional offices, and contextualized. Besides that, we are definitely looking into more strategic partnership building for the kit. We are very focused on rolling it out more widely, globally, getting it out to more countries. We are now, we have English and Arabic up on the website for the original kit, and we are in the quality review phases of Spanish and French, and they will be up on the website as well in August. Besides that, we are working on translating the adapted resource packets as well. And all of this will definitely help us reach out in more regions and connect with more UNICEF staff, partners, and adolescents themselves. As I mentioned, we have the upcoming technical tutorial that we really hope that you'll join. This one is in English, and we are only doing it once, and then we will share the recording. We're looking into having regional technical tutorials as well that will be conducted in the regionally appropriate languages. But since we're sharing the English recording, we also encourage you in country to take that recording and translate it yourself and make that available to all of your partners so that they can benefit from that more deep dive, detailed explanation of the adapted kit. So with this, we are out of time, and I want to take the last minute and say huge, huge thank you to our amazing colleagues who presented here and to the ones who were not able to present here. We heard from Colombia, Lebanon, Jordan, Tajikistan, and Indonesia. And without these 5 country offices, this would not have been possible, and this has been a great experience to working with them. And likewise with our education, child protection, and innovation colleagues. It has truly been a collaborative effort. And in these times of COVID, where we're all running around and extremely busy all the time, it has just been wonderful to see people making time for this so that we can make sure that adolescents have a chance to connect to meaningful activities so that they can continue to express themselves, stay creative, stay learning and developing themselves, and also most importantly, help cope with their new reality and situation, as we do not know when we will be back to any sort of normal standards again. So we heard all the challenges, but we also heard a lot of ideas for solutions. And as you all go about implementing or exploring the kit in your own countries, please feel free to reach out to any of us, you can email the Adolescent Kit at unicef.org. You can email Priya and I, or any of the presenters with questions. We're here to help you always. So please connect and also share your thoughts and ideas and advice to us. So with this, I want to say thank you, and I wish you a good day, and to the people on my side of the world, also a good evening. So thank you, everybody, and goodbye.
Thank you.
Thank you.
Thanks, everyone.